Hello friends, in this video we will discuss Rajasthan AMO surgery questions, and these are PYQs which are taken from last 8 papers starting from 2013 to 2022, and I have already covered other subjects also, so you can watch those videos also. So let us start with the first question in surgery today. So first question is the commonest inguinoscrotal disorder in children is. So the commonest inguinoscrotal disorder in children is inguinal hernia. Answer will be option number B, inguinal hernia. Option number A, hydrocele, and then option number 3, undescending testes and torsion testes. These defects are also seen in the children, but among them, most common is inguinal hernia. The commonest cause of oral cancer is oral infection. This can be true. Tobacco. This is also true. Dentures. This is also true. And spicy food. So all of them can lead to the oral cancer, but among these, the most common cause of oral cancer is tobacco. So the warning is also written on the tobacco packets about the oral cancers. In an acute traumatized patient, dash is the modality of investigation. So in acute traumatized patient, the time is less. So we generally do X-ray first. CT scan and MRI are time taking, and ultrasound is also a time taking modality. So these three are time taking modality, and X-ray is first. So we generally do X-ray for the acute traumatized patient, and if patient become stable, then we can go for CT scan, MRI, or ultrasound. Next question is the Lund and Broader chart is used for. So Lund and Broader chart is mainly used for the children to assess the burn wound. So it is used for the assessment of burn wound in children. So answer will be option number 3. Assessment of burn wound in children. Next question is the lesion of oral mucosa which is considered to carry a definite risk of malignant change. So oral hairy leukoplakia. Yes, this is a pre-malignant condition. Erythroplakia, this is also a pre-malignant condition. Necrotizing ulcerative gingivitis can also cause it can also change into the malignancy, but mucocele generally do not change into malignancy. So among the option number 1, 2, 3, erythroplakia will have the highest risk. So it carries a definite risk of malignant change. So answer here will be erythroplakia. Oral leukoplakia can also convert into malignancy and necrotizing ulcerative gingivitis, which is also called as the trench mouth. So it can also convert, but erythroplakia has the highest risk. Ammoniacal order is distinctive of which of the following systemic disease? So option 1 is renal failure, option 2 hepatic failure, option 3 gastritis, and ketoacidosis. So among the following option, ammoniacal order is mainly due to when there is infection of urinary tract by bacteria. So when bacteria acts on urine, it will give ammoniacal odor. So this is a disease related to renal failure. So answer will be option number A. Ammoniacal odor is seen in one is UTI, then second in kidney stones, and other renal related disease. Which of the following is not a feature of untidy wound? So untidy wound, crushed and avulsion is seen in untidy wound. This is true. Seldom tissue loss. No. In untidy wound, there is a extensive tissue loss. So extensive tissue loss should be present. So this is an incorrect option. Contaminated, yes, untidy wound generally is contaminated, and devitalized tissue is also there. So answer will be option number B, seldom tissue loss. There is extensive tissue loss in case of untidy wound. For minor surgical procedures, the usual scalpel blade size used is. So they are asking about the minor surgical procedure. So answer here will be option number B, number 15 blade. It is mainly used for the minor incisions. But if we talk about number 11 blade, then it is used for the stab incisions. So answer here will be number 15 blade, which is used for the minor incision and making a precise incision. High tension electrical injuries can be caused by following except. So it can be caused by flash. This is true. Flame. This is also true. And current itself, yes, it will cause electrical injury. And rapid heating of air with explosion. So rapid heating of air with explosion during the electrical injuries can lead to burn wound, but not directly the high tension electrical injuries which will affect body. Uh, so answer here will be rapid heating of the air with explosion, because it will lead to burn wounds, and these are superficial wounds mainly, but high tension electrical wounds which are deep is caused by flash, flame and current itself. The following are advantage of free tissue transfer except. So free tissue transfer, more simpler surgery exercise, no. It is indeed a complex procedure. Uh, being able to select exactly the best tissue to move. Yes, this is true. We can select the tissue that we have to move, and only takes what is necessary. This is also true. Only the tissue is taken which is necessary and minimizes the donor site morbidity. Of course, if we take a lesser tissue and only that tissue that is required, so it will also minimize the donor site morbidity. So this is also true. So answer here will be option number A, that more simpler surgical exercise. No, it is a complex procedure and need a good surgical experience. Next question is Heller's operation is done for. So this is a direct question. Heller's operation is done for achalasia cardia. If we talk about pyloric stenosis, then we will do myotomy. For peptic ulcer, we generally give drugs, PPI, and for carcinoma esophagus, in advanced cases, we will do esophagectomy with conduit replacement. So answer here will be achalasia cardia. Gyromagnetic property of proton is used in medical field in. So this is again a direct question. Gyromagnetic property is used for the MRI. Option number B is correct answer. CT scan uses X-ray. Ultrasonographic use ultrasonic waves. Next question is PUD orange of breast is mainly due to. So PUD orange of breast is mainly due to the cutaneous lymphatic obstruction. And if we talk about the stage in TNM staging, then it is Stage T4B, and it occurs due to the cutaneous lymphatic obstruction. If we talk about the fourth option, pull exerted by the ligaments of Cooper, then it generally lead to the dimpling, or retraction of nipples can also occur. Next question is, sensory supply to the peripheral part of the diaphragm is derived from. So if we talk about the diaphragm, then it has the two parts, central and the peripheral part. Now if we talk about the central part, then it is supplied by the phrenic nerve, and it is mainly a motor supply. But if we talk about the peripheral part, then it is mainly supplied by the lower six intercostal nerves starting from T7 to T12, and these are mainly sensory supply. So in the question they are asking about sensory supply only, and they have also given the peripheral part of the diaphragm. So answer here will be option number C, which is lower six intercostal nerves. Next question is, breast MRI provides additional value over the conventional breast imaging. So first option is, in surveillance of the woman with the high breast cancer risk. This is true. The screening for the MRI starts from 30 years of age, because mammography cannot be used less than 40 years. So if there is high risk for the breast cancer, then we start the MRI screening. In patient with axillary metastasis and negative mammography and breast ultrasound, in this also MRI provides additional benefits. So when mammography is negative, then we can do MRI for finding the cancer. This is also true. In imaging breast with silicone implants, so for silicone implant, the investigation of choice is MRI only. So this is also true. So answer here will be all the alternatives are correct. Option D is correct. Next question is, the 35-year woman has a discrete lump in her breast, but there are neither benign nor malignant focal lesions in mammography and breast ultrasound. Following should be done except. So they have given that the woman is having a discrete lump, but mammography and ultrasonography both are negative. So what should be done next? To tell the patient that there is no need to worry because the imaging is negative. No, this is not correct, because if mammography and ultrasounds are negative, then we have to go for other modalities to find why discrete lump is present. So this is wrong statement. We should go for MRI and biopsy. If MRI and biopsy are negative, then we can say that there is no breast cancer, or we have not find any positive finding. But before doing MRI and biopsy, we cannot say that the imaging is negative. Perform core needle biopsy in palpation control. This is true. Perform breast MRI. This is again true. And perform surgical biopsy. This is also true. So we have to do other modalities, and just do not say the patient that there is no need to worry before doing other modalities. So answer here will be option number A. This is a wrong statement. A singer complains of not being able to sing high notes following her thyroidectomy. So what is the likely cause? So for singing high notes, there should be tension in vocal cords, and the tensors of vocal cord is cricothyroid, which is supplied by the superior laryngeal nerve, which is a branch of external laryngeal nerve. So, so here the singer is not able to sing high notes. It means the cricothyroid is paralyzed. So either the superficial laryngeal nerve, which is a branch of external laryngeal nerve, is damaged. So option number A, damage to the recurrent laryngeal nerve. No. Option B, damage to the external laryngeal nerve. This is true. Then damage to vagus nerve and tracheal stenosis. This is also not true. So answer here will be option number B, damage to the external laryngeal nerve, because the branch of external laryngeal nerve, which is a superior laryngeal nerve, supplies to the cricothyroid, which is a tensor of vocal cords and help in achieving the high notes. A man undergone an open inguinal hernial repair. During the procedure, spermatic cord is visualized. So what structure does this contain? So they are asking about the contents of spermatic cord. So pampiform plexus is present. This is true. Femoral branch of genitofemoral nerve. No. Genital branch is present. Inguinal nerve. No. And inferior epigastric artery. No. So only from the given option, pampiform plexus is present. And if they talk about the genitofemoral nerve, then genital branch is present, not the femoral branch. So answer here will be option number A, pampiniform plexus. Splenectomy patients are at particular risk of overwhelming sepsis from which organism? So after splenectomy, there is increased risk of infection from the organism such as meningococci, streptococci, and Haemophilus. So they are basically encapsulated organism. So among the following options, anaerobic bacteria, no. Bacteroids, fragilis, no. Haemophilus influenza, this is true. And fungi, no. So answer here will be option number C. And other example can be meningococci, streptococci. Thyrotoxicosis is characterized by which of the following? So in thyrotoxicosis, there is increase in the thyroid hormone. So increase in the basic metabolic rate. So weight gain, no. There will be extensive weight loss. Proximal myopathy, yes, this can occur because it will damage other body tissues also. Enophthalmos, no. Instead, exophthalmos will be seen. And hypertrophy of the vascular elastic lamina, no. Instead, atrophy can be seen. So answer here will be option number B, proximal myopathy, which can be seen in the thyrotoxicosis. Which statement is true for Meckel's diverticulum? So first is present in 20% of the population. So this option is incorrect because Meckel's diverticulum is present only in the 2% of the population. Arises from the mesenteric border of jejunum. This is again a false statement because it arises from the antimesenteric border. May contain heterotropic pancreas. Yes, this is true because in Meckel's diverticulum, heterotropic tissue such as gastric tissue and pancreatic tissue can be present, and is present only in males. So this is again a false statement. It can be present also in females. So answer here will be option number C, which is a true statement. May contain heterotropic pancreas. During a cholecystectomy, a cystic artery must be located and ligated. This arterial supply mostly arises from. So they are basically asking about the different branches of the celiac trunk. So let's study the celiac trunk. If this is a celiac trunk, then one branch is left gastric artery, one is splenic artery, and third one is common hepatic artery. Now from common hepatic artery, one right gastroduodenal artery arises, and after that this is converted into the proper hepatic artery. When proper hepatic artery finally divides into the left hepatic artery and right hepatic artery. This right hepatic artery generally gives the cystic artery a branch which will supply to the gallbladder. So it will supply to the gallbladder. So answer here will be option number C, right hepatic artery, because it will give a branch cystic artery. Now if we talk about a special case, then sometimes there is accessory cystic artery, which is the branch of this right gastroduodenal artery. So gastroduodenal artery. But normally cystic artery is a branch of right hepatic artery. So answer will be option number C. Next question is, a 72-year-old woman present with the ulcer over the anterior medial aspects of the lower limb. It is flat with edges sloping toward the center and has seropurulent discharge. She does not recall any trauma. She had suffered for years with an aching pain over the leg due to her varicose vein. So special point is the patient has the history of varicose vein, and now ulcer is present over the anterior medial aspect of the lower limb. Now, over the last 2 months, she has noticed that this area is now becoming brown in color. So, what's your diagnosis? So, whenever there is a ulcer over the anterior medial aspect, which is a gator's area, and after the varicose vein, then it is most probably a venous ulcer. So, history of varicose vein is present. So, it is most probably venous ulcer, because they have given anterior medial aspect, which is a gator's area, and it is the most common site for the venous ulcer. So answer here will be option number B, venous ulcer. A cystic translucent swelling in the floor of the mouth on one side of the frenulum is most likely. So they are asking about a cystic and translucent swelling in the floor of the mouth. So these three are the features of ranula. Dermoid cyst, and calculus in the Wharton's jelly. Uh, they can be a cystic swelling, but they are not translucent and generally not directly present on the floor of the mouth. So best answer here will be option number C, ranula, which is a cystic translucent swelling in the floor of the mouth. So if we talk about the treatment of ranula, then nowadays most common treatment is excision of ranula. But earlier marsupialization was also done. So marsupialization is generally done when a recurrent case is there. So in normal case, excision of the ranula will be the correct answer, or will be the correct treatment. Calculate the Glasgow coma scale of the head injury patient who opens eye to the painful stimulus. So for opening the eye to the painful stimulus, we will give 2 points, and he is confused. So for confusion, we give 4 points, and for localization of pain, we will give 5 points. So in total, 5 plus 4, 9, and 9 plus 2, 11. So total answer will be 11. So for this you have to read whole Glasgow Coma scale grading, which is EVM, eye opening, verbal response, and motor response. In eye there is 4, 4, 4, 3, 2, 1. In verbal 5, 4, 3, 2, 1. And motor 6, 5, 4, 3, 2, 1. So here for painful, 4 is for confused, and 5 for localization of pain. Next question is, which of the following is not a function of gallbladder? So reservoir of bile, this is true. Concentration of bile, this is also true. Secretion of mucus, yes, gallbladder will secrete mucus and add it to the bile. And secretion of bile salts, no. Secretion of bile salts is mainly done by liver. And if there is a blockage to the drainage of the gallbladder, then it will lead to the mucocele because there is continuous secretion of mucus. So blockage will lead to mucocele. So answer here will be option number D, which is the secretion of bile salts, which is done by liver. Best diagnostic method for breast lump is, so there are some modalities which is used for the breast lump. One is clinical examination. Then we do radiology, in which we can do mammography, MRI, and ultrasonography. And in third, we will do histopathological examination, for which we will do biopsy. So this is a confirmatory test. So biopsy is the best diagnostic method for the breast lump. So answer will be option number C, biopsy. This is used for forceful irrigation and suction in clot retention in urinary bladder. So they are asking for the forceful irrigation and suction in the clot retention. So answer here will be Alex evacuator, because Alex evacuator is mainly used for the suction of blood clots. And debris. So it is used mainly for the urological procedures. Now if we talk about this suction, then it is used for the drainage. 10 cc syringe is used for irrigation but not suction. Romovic drainage again used for drainage. So answer here will be Alex evacuator, which is used for forceful irrigation and suction both, and mainly blood clots are it is used for the suction of the blood clots. So suture materials are classified according to sources, whether they are natural or artificial, number of fibers, monofilament or polyfilament, and absorbability, which means whether they are absorbable or not absorbable. So answer will be option number D, all of the above. All are the criteria for choosing a suture material. Next question is, most common cause of thyroiditis is renal thyroiditis, subacute thyroiditis, Hashimoto, and viral. So all these will lead to the thyroiditis, but most common among them is Hashimoto thyroiditis. And Hashimoto thyroiditis is type of autoimmune disease. And antibodies are formed. antibodies are present. So next question is closed gauge piece is used as bandage having. So this is a fact based question. The answer here will be 16 into 16 fibers psi. So for closed gauge piece 16 into 16 fibers are there. Which of the following renal stones are radiolucent? So if we talk about the oxalate stone, then it is radio opaque. Then phosphate stones are again radio opaque. Cysteine stones are again radio opaque, and uric acid stones, yes, these are radiolucent. So answer here will be uric acid stones which are radiolucent and all other stones are radio opaque. Now if we talk about the shape, then for oxalate stones shape is dumbbell shape. Dumbbell is for monohydrate, and envelope shape which is for dihydrate. If we talk about phosphate stones, then triple phosphate stone has the shape of coffin lid. Now cysteine stones are mainly hexagonal. Next question is amputation is often not required in. So gas gangrene, yes, in gas gangrene amputation is required in advanced cases. In Berger's disease also it is required. So Berger's disease is vasculitis of small or shape vessels, medium size vessels. Then in chronic osteomyelitis generally we do not require amputation. We will treat it by debridement of the tissue and giving the antibiotics. Diabetic gangrene, yes, in diabetic gangrene in the advanced cases we may require amputation. So this is also true. So answer here will be option number C, which is chronic osteomyelitis, which generally do not require amputation. Next question is a definitive diagnosis of acute pancreatitis is done by. So for definitive diagnosis of acute pancreatitis, there are some tests such as amylase, lipase, etc. So answer here will be amylase test A. But if we talk about the lipase test, then it is better than amylase because increase in amylase is also seen in other conditions also. But here answer will be amylase only because lipase is not given. Following are true about hepatocellular carcinoma except. So it has a high incidence in East Africa and Southeast Asia. This is true. Its worldwide incidence parallels to the prevalence of hepatitis B. This is also true. Over 80% of the tumors are surgically resectable. No, this is not true because in the hepatocellular carcinoma, only 20 to 40% of the tumors are there which are surgically resectable. And liver transplantation offers the only chance of cure in those with the resectable disease. So this is true because in after the 20 to 40% the remaining patient in which the disease is irresectable, then liver transplantation is the only method of cure. So this is again true. So answer here will be option number C, that over 80% of the tumors are surgically resectable. This is a false statement. Next question is stone which is resistant to lithotripsy. So lithotripsy or ESWL. Lithotripsy or ESWL. is used for treatment of the stones, but it is not useful in cystine stones because they are hard stones. So cystine stones are hardest among the following option and they have compact structure. So for these cystine stones we will use PCNL. So ESWL or lithotripsy can be used for calcium oxalate and small triphosphate triple phosphate stones. For larger triple phosphate stones also we will use PCNL only, and for uric acid stones also we can use ESWL. But cystine stone which are hardest and have the compact structure, we will generally use PCNL. So answer here will be option number C, cystine stones. Mayo's operation is done for. So this is a direct question. Mayo's operation is done for umbilical hernia. Answer will be option number B. So umbilical hernia is common in adults, but if we talk about children, then periumbilical hernia is common. Which of the following is not a intravesical chemotherapeutic agent? So mitomycin C is there. It is a chemotherapeutic agent. BCG. BCG is immunotherapeutic agent. And epirubicin is again chemotherapeutic agent and thiotepa is also chemotherapeutic. So from the given option, BCG which is a immunotherapeutic agent is the answer because it is not intravesical chemotherapeutic agent. Though it is used in the bladder cancer, but it is immunotherapeutic agent. Circumcision is included in management of carcinoma penis. So this is again a direct question. Circumcision is done when the carcinoma is present in prepuce. So answer here will be option number C. When carcinoma is present in prepuce, then we will go for the circumcision. Which fruit juice help in preventing the UTI? Among the following options are grape, raspberry, cranberry and orange. So from the given option, cranberry juice is used for preventing the UTI because the components present in the cranberry help in preventing the adhesion of the bacteria, so which will prevent the UTI. So answer here is cranberry because its juice help in preventing adhesion of bacteria, so prevent UTI. And in Hindi it is called as karonda. It is a small red color fruit which is sweet in taste and it is called as karonda in Hindi. First line treatment of keloid is. So first line treatment of keloid is interlesional injection of steroids, local steroids, radiotherapy and wider excision. So answer here will be interlesional injection of steroids because local steroids do not work and radiotherapy and wider excisions are used in advanced cases. So answer here will be interlesional injection of steroids. Option number A. So TPN is indicated in all except. So first option is short bowel syndrome. Yes, this is true. Burns. Yes, in burns also it can be used in the severe cases, but generally in burns we will give normal IV fluids. TPN is generally not given, but in the severe cases when patient is not able to drink or eat, then we can go for TPN. So this can be yes or no. In sepsis, yes, of course, in sepsis we will give TPN only and we will not allow patient for the enteric nutrition. Then enterocutaneous fistula. Whenever enterocutaneous fistula is present, then we will go for the TPN. So answer here will be burns, though there is no correct answer in this question, but the best answer here will be burn. And I think in the official answer key, short bowel syndrome is given as the answer, but according to me, the answer will be burn. In Glasgow coma scale, all the following are considered except. So we have already studied it in previous questions. EVM, I, verbal and motor. For I, 4 scoring are there, 4, 3, 2, 1. Then for verbal, 5, 4, 3, 2, 1. And for motor, 6, 5, 4, 3, 2, 1. So eye opening, verbal response and motor response is there, but sensory response is not considered. So answer here will be option number D, sensory response. True statement about splenosis. So options are occur after traumatic rupture of the spleen. This is true. Function as normal spleen. Yes, this is true. Multiple small implants of splenic tissue on the peritoneal surface. Yes, this is also seen. So splenosis is generally so the options, all options are correct regarding the splenosis. So answer here will be option number D, all of the above. Proximally obliterated processus vaginalis is seen in all except. So they are asking about the obliterated processus vaginalis. So options are vaginal hydrocele. This is true. Congenital hydrocele. No, this is not true because in congenital there is no obliteration. Obliteration is absent, and so the fluid from abdomen cavity can move into the scrotum. Then infantile hydrocele, in this obliterated processus vaginalis is present, and incysted hydrocele also. So answer here will be congenital hydrocele in which obliteration is not present, and it is there is a connection between the abdomen and scrotum, between which fluid can flow from abdomen to scrotum. One French size of angiographic catheter corresponds to. So this is a fact based question. One French is equals to 1 by 3 mm, which is 0.33 mm. So answer here will be option number A, 0.33 mm. So French is generally used for the external diameter of catheter. Which of the following is or are commonly present in medial mediastinum? So schwannoma, no. Thymoma present in anterior mediastinum. Bronchogenic cyst. Yes, cystic lesions are present in middle mediastinum. So this is true. And teratoma. No, this is not true. So among the following option, best answer is bronchogenic cyst, which is found in the middle mediastinum. Now, if we talk about the posterior mediastinum, then neurogenic tumor are common. And in bronchogenic cyst, which is present in the middle mediastinum, other which can be found in the middle mediastinum is mesenchymal tumor or lymphomas. Lymphoma is also present in anterior mediastinum. So next question is true about esophageal perforation. So morbidity is mainly due to mediastinal infection. This is true. Partial tear involves mucosa should be managed conservatively. So when there is partial tear and involving only mucosa, then it should be managed conservatively. This is also true. Simple exploration and end-to-end anastomosis is done as soon as possible in all cases. No, there is no procedure which should be done in all cases. So this is a wrong option.